Thank you. So first, thank you, Reb Aaron. That's very kind words, and I really appreciate it. And I thank you all for taking the time to hear what I have to say. And as you heard, my background, I was a biomedical engineer, and I'm a spine surgeon. I've had a phenomenal career, a wonderful life. There's nothing I'd rather do than be a spine surgeon, and which is really good. And I just want to tell you a little bit about how life came about for me, and how becoming observant, more observant, how it happened. So I grew up in Long Island, New York, for those of you here on the West Coast. But I grew up in Long Island, and my family went to a conservative temple. I went to public school. I went to college. I have a degree in biomedical engineering, and I graduated #1 in my class. And I got into my top choice of medical school, and got into my top choice of residency, and I got into the #1 spine fellowship in the country in orthopedics and neurosurgery. So when I looked at it, I felt that, you know, I always knew there was God, but I really felt that I worked really hard, and there was a large portion of it due to that. And I would say maybe 15 years ago, and so I've been out of medical school, let's see, carry to one. So I've been doing this 29 years as a fully trained doctor, so it's a long time. And things in life, you know, wonderful. I have 3 daughters, a granddaughter. Certain things in life weren't making sense to me, unrelated to medicine. And many years ago, Rabbi Grumman and the whole group of rabbis at BMG started sending out these outreach rabbis to communities. So at the time, my daughter was going to be bat mitzvahed, right? And she's now 29 with my granddaughter. So give you an idea how long ago that was. And she was very serious about learning, and all of my kids went to Jewish day school, and I was like, my wife and I, we were like, oh, we don't want them to go anywhere too religious, because we both went to public school and we both did very well, so it's probably good enough. And the answer, quite honestly, is it wasn't good enough, and we started learning more and more. And then my oldest daughter said, you know what, I think I really want to, you know, I'm a little confused with this, the vagueness. I want to be a little bit more observant. And that started a many-year program for us of trying to figure out how to become more observant and how to negotiate a family that was comfortable doing what we were doing. Change is always hard. And it went from, yeah, we would go to temple on Saturday, but I would drive a car if we were going to an event, and, you know, if the TV's on, it's okay, just not. This growth was a little bit difficult, and Rabbi Landau and Rabbi Gross are the 2 rabbis who were in the town that I live in, where we built this Torah links. And one of the rabbis said that becoming observant was like going in a pool. I said, well, what do you mean? He goes, you ever look at a swimming pool and you see everybody's in the pool, they're all having a great time, but you stick your toe in and it's freezing? I said, yeah. He goes, that's what it's like. It's tough to get in, but once you're in, it's a lot more fun. And that was a very apt description. It was difficult, meaning that it's difficult to change. No one really wants to change. It requires effort. It requires knowledge. It requires motivation. You got to have the output. And From there, I started doing more learning. I, with my daughter, studied for Purim, just to show you how far this went. When my daughter went to be bat mitzvahed, she read the entire Megillah in Hebrew from the parchment, and now she made Aliyah, lives in Israel, and wears a wig as a religious Orthodox Jewish woman. And this is my little daughter from a few years ago, even actually 17 years ago. But that's where my family was. And I think the part that I really wanted to concentrate on, hopefully with that little bit of backdrop, is that original item that I spoke to you all about, which was, where do each of us fit in? And what is it that God does for each of us in giving us an opportunity and a mission in life? And I really think that over a many decade experience, I started to see things that made a lot more sense to me the more observant I became, and specifically how it related to God. Because at times I would say to myself, wow, I did a great surgery and the patient didn't do well, or maybe may not survive, despite the best of my technical skill. And other times, people would do very well, and I didn't think it was particularly any phenomenal surgical intervention. And I started saying, you know, I wonder if, you know, to me, God was religion and the weekend and eating kosher, and medicine was over here. And they were a little bit bifurcated, I guess is the best approach I could explain it retrospectively. And what happened was I started getting a much deeper understanding and appreciation of where I individually fit in this world. How did I get to where I was? Why did it happen? What mission am I fulfilling? And who's really running the show? And, you know, to summarize 30 plus years of clinical experience, plus 10 years, you know, after college, including med school, internship, residency, and fellowship, that's a lot of time to think about where things come from. And really what ended up happening was, instead of, like I always looked at it when I was much younger, that if you're so religious, you're really limiting yourself. You know, you're just learning and you're not really doing. If you're going to do, and if you're going to learn, and the two of them didn't match. At least that's what I thought. And what I really learned was that the more you learn, the more you're able to integrate all of that information and see how it plays out. And I'll tell you two quick anecdotes, and then we'll talk a little bit about this. But one of the stories that I would always talk about is when I say to my patients, you know, and they say, you know, how's the outcome from surgery going to be? And I can always quote the literature and tell them what it's going to be. And I always say, you know, God willing, surgery will go well. And sometimes they look at me and they go, hey, doc, you know, I don't believe in that stuff. I don't believe in God. So I say, okay, do you believe in me? They say, you I believe in. I go, okay, believe me, I'm right. There's a God. You may not know it, but I'm telling you God's there. And I was asked to speak a number of years ago at a high school for students who were challenged and came from religious observant families. And they were trying in their late teens, early 20s, trying to get a GED, right? So very different from where all of us are, and the ability to go on and look at a career and decide what you want to do, and seeing all these bright and wonderful, open-minded people. And I remember seeing all of these students, and they were really challenged in terms of learning. and doing math and English and reading. Everything was very difficult for them. But they wanted to speak to me. And I said, of course, I'll come speak. Why do they want to talk to a public school kid? I don't know anything. They're like all from these fancy Jewish families. Maybe they would do a better job speaking to them. And they said, no, they really want to talk to you. So I went to them and said, look, yeah, I have a degree in biomedical engineering. I have patents. I have everything in the world. I have a great career. I love what I do. You should know that Monday this week, I operated on my cousin. I love what I do. I operated on my sister a few years ago. You're never supposed to do that, but my family's a little difficult. But at the end of the day, so I went to see all of these students, and they were really struggling, really struggling. And I said, what could you possibly want to hear from this public school kid? And they said, we really want to understand from you, how is it that you could be a doctor, a scientist? You understand all of these philosophies, you know physics, you know the Big Bang Theory, you know evolution, you know everything. How do you believe in God? Pretty good question, right? How do you know there's a God? So I told them the following story, and I tell it to all of you, and hopefully you all know the solution. So I said, imagine, let's forget about the human body for a minute. Let's take a piece of paper. You write the number 1 on one piece of paper, and then you write the 2 on the next piece of paper, and you go all the way up to 17. And you throw the 17 pieces of paper in the air. What is the chance that the papers will land 1 to 17? And I don't care if it's upside down, right side up, sideways, backwards, forwards, just 1 to 17. So I'm sure many of our college students will know the mathematical formula for that. But let's put Reb Naftali on the spotlight. All right, Aaron, can you, oh, good. So Naftali, yeah. Tell me what you think the likelihood statistically would be for 17 pieces of paper to land 1 to 17. 1 in 1,000, 1 in 1,000,000, 1 in a...
It would probably be a number that I can't pronounce with a lot of zeros. Maybe there's 17 zeros or 15 zeros, but it's probably a lot of zeros behind it.
That's a pretty good guess. The answer is 1 in 355 trillion. That's the statistical likelihood of 17 pieces of paper that don't have to do anything other than just land. Now, every day, I am inside of human beings, and everything is in the right spot. So if you sit there and you look at, for example, take any person in the world and look at the ability of their pancreas and put that in one room, and you take every computer we have, every imaging system we have, and put it in another room. The human pancreas does a far better job monitoring blood sugar than any computer does. And if you look at a human eye, your human eye adjusts to more conditions more quickly, more depth of field, stereoscopic vision. All of the things your eye can do does better than every camera in the world. And the spinal cord, if you look at, they have these exoskeletons where they take people who are spinal cord injured and they put them in this robot to help them up and walk. And it's a whole computer system, and they really look very bizarre. If you look at your own spinal cord and you look at your own gait mechanics and how your body walks, it's amazing. You can't program a computer. A computer can't program itself anywhere near good enough as anything that your body does. So the way I look at it now is a little bit of the opposite. I look at it that when I open up one of God's creations, it is so clear to me that there's God, I saw everything but watching his finger do it. It's obvious to me. So if you said, look, I see artwork, sometimes it's a little modern. Maybe somebody just splashed the paint at the wall and it looked like art. Possible. But that's like saying, let me see you splash paint and boom, it's a Mona Lisa. Or throw metal and wood and electric in the air and build a building. To think that there is not a master designer, to me, is so obvious. So how has that changed my life? Well, that recognition really leads me to say to my patients what I told you before. It's really not up to me. It's up to the boss upstairs who I work for. And I will tell you that it gives me a much more reasonable position in life. And I think if I looked at it retrospectively, there was so much that I would put on myself that it had to be the best. And, I still have CDO. Does anybody know what CDO is? That's OCD so bad you have to alphabetize it. I'm so focused and intense on what I do. And a lot of problem with healthcare is many of us get like that. And unfortunately, we've had quite a few number of suicides of doctors. My wife and I started a foundation called Humanology to try and teach up-and-coming physicians how to balance that knowledge, what you're doing God's work, and then on the other side, where you're told by an insurance company what you can and can't do, and I guess them wanting you to do, for lack of a better word, the devil's work. And how do you negotiate both of those together? How do you teach people that position in their life? How do you find meaningful experiences with all of the HIPAA violations? You can't come in the room, you're not trained enough, you can't see the patient's name, you can't know this, you can't know that. There's some tremendous challenges that there are in healthcare. And I think the best advice I can give you is, if I could go back to when I was in college and have a different view, the best advice I would have given myself at the time was, you really need to have a broader understanding of where you, Steve, fit in life and how you see yourself in that entire process. And I can only say that the transition that I've gone through for these past 17 years, I wish I started that many years prior. And I think of the many challenges and problems that I've had, and that lack of recognition of where I fit in that entire process certainly made it harder for me. And the understanding that I am here fulfilling a mission and really fulfilling God's mission is tremendously powerful to me. And I'll leave you with one last little bit from the public school kid. We always have the prayer of Ashrei, and there's one portion of it where, we say the sentence in Hebrew, which is Poteach et yadecha umasbia lachol chai ratzon. You should open your hands, and God should, open your hands, open up my hands, Poteach et yadecha umasbia lachol chai ratzon, and you should fulfill my desire. So sometimes I would watch people who are Sephardic Jews who would open their hands like this when they're praying. And I looked at it, I said, wait a second. Why are you opening your hands? Are you saying, hey, God, can you put what I belong right here? Like, don't put it in that guy's hand, put it here. It didn't make sense to me. And I heard a wonderful lecture. I'm sure many of the ones that the Rebbeim on the phone are making sure you hear. This was from Dodi Tobin. And she said that everybody has a job. When you read about Cain and Abel, they have a job. Everyone's described in terms of what their job is. And she was talking about this prayer. and said during, when we were talking about this prayer, and I was like, you know what? I can retire. I love what I do, but I'm getting very frustrated by some of the forces around me telling me what I can and can't do. That doesn't usually work well for me. I'm just not that kind of, I don't respond well to that kind of stuff, especially when an insurance company is telling me what I can or cannot do. So that usually involves a discussion which gets much more aggressive. And this Dodie Tobin was giving the lecture, and she said, when you say, open my hands so I can fulfill your desire, your ratzon, it's, it's my ratzon. She said, you're looking at it the wrong way. It's God's desire. It's God, you allow me to open my hands so I can fulfill your desire, your ratzon, what you want from me. And that one learning, that one sentence totally stopped me in my tracks from giving up operating, which I love to do, which is my favorite thing in the world to do. And it wasn't a monetary issue, not an anything issue at all. I was just confused about where I fit in. Where was my responsibility? Who put those gifts in my hand? Did I work hard like all of you are working hard and we'll work hard? Absolutely. It's a lot of sweat and blood and tears and misery and missed stuff in life. And you probably feel, hey, the world should at least give you a little recognition. Look at what you did. And I guess I was feeling that. And, don't tell me what to do. I know the right thing to do. I don't want to argue with insurance companies anymore. And that one little sentence every day when I pray and I say that prayer and I open my hands up, I don't ask God, hey, put it here. I say, God, you see, I'm opening these hands and I'm here to do your work. And that's created such tremendous joy and happiness in my life. But more than all of that, it's created meaning and really understanding. And it's provided me the ability to look at my patients and to understand my position. And it's also provided me the ability to look at myself and see where I fit in and to try and remind myself of how to best be a doctor and how to best advocate for my patients. And that was my journey. So I thank you all for listening, and I am more than happy to answer any questions. So I'll turn it over back to Reb Aaron.
Thank you very much, Dr. Reich. Rabbi Naftali, you want to jump in here quickly?
Thank you so much, Doctor. That was really amazing. I would open up if you have a couple minutes here. If anyone has any questions, feel free to unmute yourself and you could ask the question or you can chat in.
You could ask about anything, because the last time I did this with Dr. Reich, I made the mistake of going to a famous eatery in Lakewood, and about 12 young men from our Lakewood Fellowship program were there, and it cost me an hour and a half, and had to pay for a lot of other people's pizza. So go ahead and challenge. And by the way, we went on his Harley.
Yeah, so I drive a Harley just to keep everyone a little crazed. And when I pull up at the, everyone looks like Rabbi Grumman. They all wear black hats and black suits. And when I saw Rabbi Grumman a couple of days ago at a wedding, although I wore a black suit, I like to be very different. Of course I am. And people respect crazy. So that's why everyone respects. They think I'm out of my mind, which is, they are correct. But I'd really love to hear anyone's question. And there's nothing you can ask that I won't attempt to answer if I can.
I have a question, Doctor.
Sure, please.
So I wanted to know, how has being a religious Jew and being someone who keeps Shabbat, keeps kosher, all these things, how is that in terms of not practicing on Shabbat and not studying when you were younger in med school? Did you keep Shabbat when you were a medical? Okay, so I guess how was that, and how did you prevent falling behind and putting yourself at a disadvantage by not studying on Shabbat, by not being able to do things that other med students are doing, and even right now by not practicing on Shabbat? How do you like maintain your level of excellence? I guess is my question.
That's really a phenomenal question. And I think, you know, so when I was in high school, I went to public school. So there was no, hey, you're off for the holidays. The holidays, it's fair game. They offer a test. You know, I'd say I can't do it. And clearly, it was challenging going to public school and doing that. I never went to school on a holiday. I wasn't Shomer Shabbat until later, and like I said, till 17 years ago. So I had finished medical school, and I was in my practice. Certainly in practice, you're able to save a life to do anything. But I will say that, and I have many friends who were Shomer Shabbat throughout. And I would say I liken that to people in the business world. I think God makes it in such a way that you're rewarded for what you do. And I would say for myself that there has never been an issue, and for the limitations that I've had on not going on Shabbat if I could, or avoiding having to go to the hospital, I think everybody in my world has been extremely supportive of that. Again, I'm a little bit older, and I think people want to see human beings with depth. You know, I still, where I went to college for the biomedical engineers, I still consult, and I talk about people applying to medical school, and where I did my residency at NYU Joint Diseases in Manhattan, and fellowship in Philadelphia and Jefferson and Pennsylvania. I still always talk to people, and I always say, you know, how do you distinguish yourself? How do you have value that someone else doesn't have? And, you know, if you have, you know, 500 students who studied biology and everyone did this and everyone did that, well, what makes you different? And I really believe that having something in life and understanding your position really puts you in a very different category. And I think when people see that you're willing, like as I would do, I would volunteer to work every day, every holiday, Easter, Xmas, I was the guy. And I always did, because I never wanted to work a Jewish holiday. And I always felt that it was so important. And every place where I went, I considered that very much embedded within me, even though I wasn't observant. But had I had to do it again, I would have zero doubt and concern. And I would feel strongly with that. And I think the biggest issue is we may think we're running the show, but it really comes from the higher up. And I think God helps all of those things through. So I would tell you, don't feel in any way you have to shy away or back off. And you can do that. And all the people that I've known, I never took a test on a Jewish holiday. Never once went to school on any holiday. I went to public school. I went to regular college. I always had to talk to people to not have to do the test. I guess I was more religious in the conservative world. And I even had one time where someone told me if I didn't take a test that I would get a 0. And that was in organic chemistry. And I ended up show you how it works. So here I am. My dad had died. I was on a scholarship to go to school. I had one choice to go in the world, and I did graduate #1, and someone's telling me I'm going to get a 0 in organic chemistry, which would basically end your chance of going to medical school. So I happened to know the president of the university and the dean of the College of Liberal Arts from going to the Hillel on Friday night. the Hillel was the dean, and I knew the president because they gave me a scholarship. I felt obligated to take students on potential walks through the university. And I was a president's host, and I knew the president well, and I had this event happen, and I went to the professor after the class. I said, "You scheduled the test for Rosh Hashanah," and he moved it to Sukkot because he originally had it for Rosh Hashanah. Then it was the Monday. Then he said it'll be the following Wednesday on Yom Kippur. Everyone went crazy. He said it'll be the following Monday, which was the holiday of Sukkot. So I went up. I said, "Look, most Jews don't observe all the holidays. Those are the big three. I don't think it'll be a problem for anyone else, but for me, I won't be able to take the test." And he said, "Well, come back to me." So I go back to him like a week later, and I said, "Professor," I can't give you his name, but it was Petersdorf. I said, "Professor Petersdorf, I just wanted to follow up with you." And he looked at me and said, "Oh, I spoke to my people, and they told me if you don't take the test, you get a 0. And I have nothing. I have no parent, my mother, but my father's gone. I'm on a scholarship. This guy's going to ruin my life." So I said, "Professor Petersdorf, it's very interesting you mentioned that to me, because I was just talking about the issue with the president of the college. And I'm sure he'll be very surprised to hear this. Matter of fact, why don't you call him? You know what? Better off, I'm going to have him call you." So he goes, whoa, okay, give me one more second. I'm going to recheck the story. And I go to Hillel services that Friday night, and I see Dean Blau, who's the Dean of Liberal Arts. And he comes to me and he goes, "Steve, I got him." I go, "Who'd you get?" He goes, "I got him." "Well, what are you talking about?" He goes, "I got him." I go, "Who'd you get?" He goes, "I have one guy comes to me and goes, I have this student in my class who's telling me about a Jewish holiday and is threatening to have the president of the university call him." He goes, I look him right in the eye and I said, "If it's Steve Reich, he'll have your job." He goes, "I knew it was you." He goes, "I told him it was a holiday." And I go back to this class. He sees me in the big auditorium. So he's like, "After class, you come, we talk." So I saw Professor Petersdorf. I walked down at the end of the class. "Oh, I spoke to my people, and they told me, no problem at all. You can take the test home now. You could bring it back in 6 months. You could do it with your friends. I'll give you an A." The whole story changed. So I said to him, "Professor Petersdorf, I'm sure the only reason you've changed your mind is because you recognized that if you went against me, the president of the university would have terminated you. Don't let me ever hear you adversely act to a Jewish student like that, ever for a religious reason." Now, that's called a bluff. I had nothing. I would have gone to the president over it. But, sometimes you got to do what you got to do. And that's what happens when you don't grow up religious. You have a set of kahunas. And, when your back's against the wall, the sky's the limit. And I had nothing. So what did I have to lose? They would have been mad at me. Okay, next question.
Wow.
Did I not?
I have a quick question, not necessarily related to
please.
Judaism, but I was kind of curious about what made you decide that you wanted to go into orthopedics.
Oh, that's a good question. So this is another story that has a lot to do with believing in God. And when I was in college, I worked on a design of a retinal scanner, which looked at a condition for people who have diabetes and they become blind from a condition called diabetic retinopathy. And, we designed this. It was a great project. I spoke to all these ophthalmologists about it. They're like, "Oh my God, you got to come here." It was Mass Eye and Ear. They're at NYU. "Oh, you're going to be an ophthalmologist." And they're telling me how great it's going to be. I go, "Great, I'll be an ophthalmologist. I go to med school, I'm all in there, I'm ready. I finish my first couple of years of med school. I'm ready for my first day of ophthalmology. I go into ophthalmology to the clinic. I'm unconscious. I'm asleep. I'm like, oh my God. I finish. I call my wife at the time. I'm like, oh. She goes, how was your first day of ophthalmology? I go, it was horrible. I fell asleep. It was the worst. I couldn't even. She goes, you know what the problem was? You stayed up too late. You were too nervous. It was such a big worry for you. You should have gone to bed. I want you to go to bed tonight, have a warm glass of milk, knock yourself out, go to bed early, and you'll go in tomorrow. Don't give yourself, don't get crazy. I go to bed early. I get up early the next day. I walk into the clinic. By 10 o'clock in the morning, I don't know what to do with myself. The end of the day, I call my wife. She goes, how was it? I go, not only can I not be an ophthalmologist, I don't think I can finish the 2-week rotation. I hate it. It's the worst thing I've ever done in my life. So I'm real miserable. And I go over to, at med school. And at Einstein, I went to Einstein in the Bronx. They have a pool table in the lounge, in the students' lounge. So I'm playing and I look pretty miserable. So one of the guys says to me, goes, dude, what's with the long face? You're always such a happy guy. I tell him the story. I thought I was going to be an ophthalmologist. I just ruined my whole life. I hate it. I have nothing. He goes, dude, you'll never be an ophthalmologist. That's just not the right personality for you. You're going to be an orthopedic surgeon. I said, what do they do? He goes, doesn't matter. That's what you're going to be. And that's the truth of how I decided to become an orthopedic surgeon. And just to make the story even worse, when I trained at Hospital for Joint Diseases in Manhattan, I liked sports medicine and I liked spine surgery. But spine surgery was risky and I didn't know which one to do. And I'm applying to both programs. I'm asking for advice. And one guy, Dr. Jerry Lubliner, says to me as follows. He goes, it's an easy decision. He goes, I want you to pretend you have a drink in your hand. I go, okay, I have a drink. He goes, in one room is all the spine surgeons, They're all drinking in there. And one room is all the sports medicine surgeons, and they're all drinking in the other room. He goes, I want you to pretend to go in the one room with your drink. And then I want you to go in the other room with your drink. I imagine it. He goes, what do you think? I go, a couple of the guys in the sports medicine room I really didn't care for being around. I like the spine surgery room better. He goes, you're done. You're going to be a spine surgeon. And that is exactly how I became a spine surgeon. How's that?
That's great. Thank you.
So don't get too excited. You got plenty of time. And pencils have erasers. You got to see what speaks to you, even when you may not know. Much more important to feel what you love to do. And if they say if you love what you do, you really never work a day. Even though that's not really true, but the idea is pretty much there. Next question.
Exactly. I have a quick question, Doctor.
Sure.
I loved your speech, by the way. It was really like everything that I thought of the same way, the same issues about, going through, becoming a doctor and how faith intertwines with it. It's very tough sometimes. And I know one part of it, you talked about how the challenges in your life challenged your faith. And I remember you said about your other personal issues with your family. What was the breaking point where you had to say, is God real? What was the breaking point for you? Because I know you're a very, very smart man, obviously, and you've dealt with, a lot of different topics and lessons in your life. I know how you said you opened the, human up and you saw how intricate the body was. But was there a point in your life where you said, what made you want to go search after that question?
That's a great point. It was interesting because for me, and I hate to steal someone else's lecture, but I heard someone say, it was a group of all educated people. He said, how many people in this room made it through elementary school? Everybody raises their hand. How many people graduated high school? 100%. How many people graduated college? Virtually 100%. How many people have a postgraduate degree? Lawyer, engineer, doctor, accountant. Everybody's raising their hand. He said, how many of you in this room could do what you do now with with your 12th grade education? Say you were in 6th or 7th grade. Who in this room could do what you do with graduating 6th or 7th grade in public school or any school? Not one person raised their hand. And the answer was, but that's what most of us did with Jewish education. So I'm applying even though I went on to Hebrew high school for a few years, I'm applying basically a very minor education to deal with a big topic. So for me, it was much easier to ignore the topic and say, hey, things are pretty good. I got a great living. I'm doing a great job. Life's great. There was always something missing. And as I was saying before, it's hard to look at yourself and say, you know what? I got to change. Change is tough. Takes a lot of effort, a lot of attention, a lot of time. Doing nothing is the easiest, right? You sit on the couch, you watch a football game, you drink beer. That's easy. Getting up, working out, changing your life, asking, learning, that's challenging. And, things were going well. I was very busy with my practice growing, busy with family. I got involved with, thank God, many activities. I was appointed by the governor. I was the chairman of the Spinal Cord Research Commission. I teach at the medical school. I have my residence. I got everything, right? And all of a sudden, I'm sitting there, and I remember at the time of my daughter's bat mitzvah, when I didn't have really much to add. I didn't really know anything more than the storybook level, the cartoon. And I'm like, this doesn't really make a lot of sense. I mean, isn't there something more important than this, than a party and a lady? And, what's the big story here? I don't get it. And either I could spend a lot of time and try and learn about it. Why would I want to do that? My story's good enough. You drink, you have a party, you see each other, you read, it's all good. And at that time, it became this, when we started learning this book called the Malbim about Purim, I'm like, wow, there's really a lot more here. It's just not that story. I'm like scraping the iceberg. And when someone said, you basically got a 6th or 7th grade education, and for me going to public school, it was 2 hours, 3 times a week. I look at 2 hours, 3 times a week at literature and stuff that I don't even care about. And it started gnawing at me more and more. And I said, you know what? This is interesting. I think I'm going to go to a class. I think I'm going to go to another class. And it sort of became this process where I felt a lack of, it became more apparent to me of what I was lacking. And I sort of was critical of myself and saying, dude, do you want to learn about it, or do you want to keep your head in the sand? You keep your head in the sand and just keep going the way it is, or you can have a little bit more and learn a little bit more about your life and what's important. And that's how it happened. And then the more I learned, the more I said, well, I really don't know a lot. And no matter how much I learn, I still really don't know a lot. But the more I learn, the happier I am, the more content in life I am, and that perspective of where I fit in, fitting in is very important. And I think that, having spent a lot of time trying to protect people from suicide, doctors predominantly, students, one of the guys who trained me, who was my chief resident at joint disease, was the chairman of sports medicine at GW. And his kids came in the house and he was hung. He hung himself. Let me tell you, that's bad for any human to do that. 4 years of college, 4 years of medical school, a 5-year internship residency, a year of a fellowship, and you kill yourself? That's really bad. Everyone needs to have a firm understanding of where they fit in. And to me, what I see now, I think that religious understanding of where you fit in, and I think the understanding of Torah and understanding it puts it all in perspective for me. And the more I see, the more I learn. And, I wish I was on that journey many decades before. But unfortunately, it's a little later than I wanted, but I'm happy for every day I get a chance to make it better.
That was beautifully said. Thank you so much. Thank you for your
Thank
time.
you for the question.
That was really, really amazing. Like, you know how you say, there's always, people say like there's a certain push that, certain like moment that, can change someone. Like hearing your speech and hearing, speech report from Rabbi Shlomo, that's, it's something that you take years of experience from someone else to learn to influence someone else's life. So I thank you for having your time and your patience to say your story. It's really nice to hear. Thank you.
Well, it's very kind of you, and I appreciate it very much, and I really hope that, I know I went a few minutes over, so Reb Aaron's going to smack me around, but I really appreciate it. I'm more than happy to be a resource to you, to help you, to communicate, and I give you all tremendous, tremendous credit, and to go ahead and to do this program. And you'll see that people can be devoted in their professional life and devoted to religion and devoted to learning and devoted to meaning and seeing what it means to them. And it's really amazing. So I would have appreciated this discussion with me when I was at your age.
Exactly.
Unfortunately, yeah. I didn't have that benefit, but I think it's really great. And I think that you'll all see that throughout your life, you'll always have impact on people. You'll never know. And with this, I'll leave you with my final funny story. So there's a group of spine surgeons that trained at Jefferson. It's called the Rothman Institute. It's a very prestigious spine surgery group. So they have a meeting, and all of the people who are trained there as fellows, and there are 2 fellows a year, it's a very prestigious group, and they all get together. Anyway, I'm at the meeting, some guy's speaking at the front, whatever, and it's the end, I'm just listening. He goes, and I really want to say a thanks to Steve Reich. I look up, I go, I think the guy just said my name. He goes, he did. I look at the guy, I never saw this guy in my life, not even a chance I know this guy. He goes, I was a medical student when Dr. Reich was the spine fellow, right? So he was like a PG 2 or 3, and he's a medical student, MS 2 or 3, whatever he was, and I'm a PG 6. So I'm 8, 9 years away from him in training, and he said, when I came through as a medical student to the orthopedic rotation, I went into the OR, and Dr. Reich showed me how to do it, and he let me grab the instrument and take off a piece of the lamina of the bone. And that day, I knew I was going to be a spine surgeon. And I always wanted to find Dr. Reich. I never knew how I would thank him, but I'm seeing him here today, and I just want to publicly say thank you. And I would have bet everything I own I never saw the guy in my life. And like all of you, you have a tremendous ability. God gives each of us an ability. We don't see how this all fits together. That's the big boss's plan. We're just here to do the best we can. And I think if each of us treats each other well, hopefully the world will be a better place. We have a lot of problems societally, politically, all that other stuff. But to be an honest person, caring, observant, and for the rabbis, all that they'll teach you is everything that I strive to learn. So with that, I thank you all, and I wish you all the success and joy and happiness and contentment. And please, if there's any other questions, any of the Rebbeim can get me for you, and I'd be more than happy to speak with you at any time.